Hi, this is Dave Shurn, and welcome to News from National for October. It's been a busy month with us here in the National office, and I'd like to highlight three activities for you. First is the launch of the myplanmylife.com website. It's a website about psychiatric advance directives. These are legal documents that individuals can execute that express their wishes and desires should they find themselves in mental health crisis, identifies individuals who they'd like to have represent them or help them through times of crisis. We know that they can be very valuable instruments, but they are heroically underutilized. And we're hoping that with the sponsorship of Novartis for this website, we'll be able to dramatically increase public awareness of psychiatric advance directives. It's a very how-to oriented website, so people can use it to learn about the specific requirements in their states and the basic components of a psychiatric advance directive. And our hope is, as we continue to roll this out, we'll increase the utilization of these really important documents, psychiatric advance directives. myplanmylife.com. We did a great satellite media tour with an estimated over 40 million media impressions in many markets throughout the country. So the Mental Health America Network got good exposure through this, and I encourage you all to take a look at it. The second thing that happened in October during Depression Awareness Week and Screening Day on October 6th is we collaborated with Walgreens, 7 stores in the Chicago area, which is the home base for Walgreens, to test the use of depression screening instruments, both computer-based and paper and pencil-based. We did this with our Illinois affiliate. Very successful. Walgreens was excited by the prospect, and I think it helped to allay some concerns about depression screening. We're hoping that this will open the door for us to combine depression screening with the other chronic disease education and screening projects that they have ongoing as part of their wellness initiative, and that next year we'll be able to screen people for depression throughout the United States. So hopefully the affiliates will have an opportunity in their community to collaborate with Walgreens on the initiative. Finally, something that's really sort of dominating our horizon on the policy, in the policy area, is the federal budget. I think, as everybody knows, there are 2 major activities ongoing. One is the Super Committee of 12 that's been charged with finding $1.2 trillion in budget reductions over the next decade. And we've weighed in with them, along with our colleagues, on several important issues, preservation of Medicaid, among the most important, but things that are of concern to people who have mental health and addiction conditions and that are, quite frankly, at risk as they search for such dramatic savings in the budget. Second thing is the negotiations and debate over the budget for the current fiscal year that started at the beginning of October. We're particularly concerned there about pretty dramatic cuts to the Center for Mental Health Services, at least in the House bill, and are working hard to see if we can't get those restored prior to the full enactment of this year's budget. This is just not the time, given the continued rocky state of our economy, for us to be cutting back on these critically important services when we know that risk is elevated during times of economic downturn. So we continue to work on the budget and to monitor that, to work on the implementation of parity, the implementation of the Affordable Care Act. Lots going on the policy scene. I encourage you to take a look at myplanmylife.com for some valuable information about psychiatric advance directives and the many, many ways they can be helpful for people who are at risk to find themselves in mental health crisis. So for October, that's it. We'll look forward to talking to you next month.